Kennedy's disease is a neuromuscular disease which causes the progressive sufferance and degeneration of both the muscles and the motor neurons, which are the cells that actually instruct the muscles on how to move. And this can affect the legs, the arms, and actually the muscles in the head region, and therefore the muscles that allow us to speak and to swallow.
We first started noticing some sort of strange symptoms back in about 2005. I guess it's the nature of Kennedy's which progresses slowly. It was about 2009, 2010 that they got to the stage where there was clearly something wrong. And so I went to see my GP, who referred me to a neurologist who was very perceptive, and took it from there really. As a Kennedy's disease patient, we were seen by motor neuron disease specialist consultants and they knew about Kennedy's disease, but not necessarily about the condition as a whole.
Kennedy's is a rare disorder, and actually we don't know the exact number of patients affected in the UK. A couple of years back, we actually realized that there were numerous patients that were not even followed by a neurologist. And this is the reason why we decided to set up the first dedicated clinic in the UK to Kennedy's disease. We have the support of physiotherapists, we have a specialised nurse.
Part of my role is to help coordinate their care. Access to physiotherapy, access to speech and language therapists, keeping them mobile, keeping them independent. But there's a whole psychological component as well, which I think is often missed. It's also about supporting families as well, so it's about helping relationships stay intimate and meaningful.
Jan is a Kennedy's specialist nurse. She's the only one in the country. The sort of support that she gives you is just to remind you, because all carers forget to look after themselves. And she just says, and what are you doing about yourself? And what are you doing for yourself? And sometimes you actually need reminding.
The first aim is to deliver to patients a multidisciplinary and highly specialised clinical care. And the second reason is actually to create a research environment, a clinical research environment that will allow us to test therapies and basically move ahead and develop new therapeutics for a disease that currently has no proven effective treatment.
It's important to us to be involved in research. We do it for two reasons really. One, we'd like to advance the study of Kennedy's to help other people, and two, getting involved in research does give you, because of the feedback you get, a deeper understanding of the condition.
I think it's going to be slow to take off for the word to trickle out that actually we are a national centre, but we're starting now to get phone calls. There's one chap just recently, so I just absolutely phoned up and burst into tears. I thought he was the only person he knew with this disease. He said, no, we've got 70 or 80 families now, and he's just delighted that he's not alone, really excited to come, wants to give back to research. So yeah, no, it's really a positive experience.
What am I getting from the clinic? Well, one, it is just knowing that you are speaking to people who see a lot of other Kennedy's sufferers. We know they're there for us, and we know that we're not speaking to someone who's going to have to go away and look up Kennedy's disease, because they're able to tell us now from their own experience. Another advantage of coming to the clinic is that Kennedy's is a rare disease. However, when you come to the Kennedy's disease clinic, that's all they're here to look at, to research and to treat. So when you're at this clinic, Kennedy's disease is not a rare disease, it's all they're here to do.